And now for the Magnet Prize itself. Linda, when you spoke this morning about the importance of evidence-based practice in nursing, you were delivering a preamble to the inspiring work of this year's Magnet Prize winner. The nurses at our prize-winning institution are the mainstay of a unique program, leading the way in developing and promoting a rich culture of learning and evidence-based practice. Nurses are the reason the program is so successful. This year, the prize goes to a program that has been 25 years in the making and way, way ahead of its time. The program that has turned its creators into national and international leaders for adopting and translating evidence into practice. It led to the development of programs and a guidebook used by thousands of nurses in the U.S. and abroad in a variety of care settings, including acute care, home health, and long-term care. A unique strength of their program is its applicability, offering practical steps for teams working through the complex EBP process. Their statistically proven positive outcomes for patients, families, and clinical practitioners are simply outstanding. The story of how they created this program is fascinating, and we're going to leave it to the Magnet Prize winners to tell you in their own words about their journey. Please join us in congratulating this year's Magnet Prize recipients, the creators of the renowned Iowa model from Iowa City, Iowa, the University of Iowa Hospitals and Clinics.
From the Department of Nursing Services and Patient Care at the University of Iowa Hospitals and Clinics, please welcome Dr. Sharon Tucker, Director of Nursing Research, EBP, and Quality, Dr. Laura Cullen, Evidence-Based Practice Scientist, Office of Nursing Research, EBP, and Quality, Michelle Farrington, Clinical Healthcare Research Associate, Office of Nursing Research, EBP, and Quality, and Dr. Kenneth Rempfer, CNO.
Congratulations to you. Thank you very much. I'm going to get a photo.
Photo.
They're going to get a photo. Where'd they go? There he is.
We're going to move back this direction.
Oh, back this direction. Oh, come on.
Thank you all for being here and for making a difference in healthcare worldwide and the nursing profession. Nurses have long been at the forefront of evidence-based practice, and we've learned a lot from you. We are very excited to participate in this celebration of evidence-based practice and to share with you the accomplishments of the extraordinary nursing team at the University of Iowa Hospitals and Clinics. Our Department of Nursing Services and Patient Care is internationally recognized for evidence-based practice. We've earned that distinction through decades of building knowledge and improving methods and practices, by blazing trails in new quality and innovation, and by sending some sacred cows, those outdated tradition-based practices, out to pasture. So how did this happen here? What is unique to Iowa? What has made this a place where EBP can thrive? Where nurses at all levels can pursue new ideas and make real, lasting change in exemplary nursing practice. Our commitment to innovation and quality shows in our designation as one of 2014's Healthcare's Most Wired, as well as our national U.S. News and World Report ranking in a variety of specialties. We are an academic medical center with 729 beds, including a 200-bed children's hospital. Every year, we see over 800,000 patients, about 2,000 births, 1 million clinic visits, and more than 32,000 acute patient admissions. And we have more than 2,000 professional nurses. Exceptional nurses, leaders, practitioners, and scientists all came together and continue to come together to make UI hospitals and clinics a world leader in evidence-based practice nursing and research. The Iowa model, developed by these people in this place, is a powerful and an effective process that has led to positive change and improved patient care and outcomes all over the globe. As we blaze new trails, we strive to create markers so that the path is easily followed. Today, members of our team will be sharing our journey toward EBP success. Dr. Laura Cullen, who started leading EBP in her current role in 1998, will talk about the formative years in the 80s and the 90s, giving you insight into the original processes and what might be effective in your own organization. From Ms. Michelle Farrington, who started leading EBP initiatives as a staff nurse in 2003, you'll learn about the importance of empowering the bedside nurse and mentoring clinicians to lead institutional change, to innovate and reach beyond. And Dr. Sharon Tucker, Director for Research, EBP and Quality since 2011, will show you how we are all continuing to grow, creating new resources, developing new tools, and in essence, building a research foundation around evidence-based behavioral change. Evidence-based practices work at UI hospitals and clinics, and our influence, the influence of so many talented, passionate, and dedicated nurses, has spread across the country and throughout the world, improving the lives of patients everywhere. That dedication, commitment, and groundbreaking innovation have led to 3 magnet designations for us. I am delighted and gratified to be a member of the dynamic team at the Department of Nursing Services and Patient Care at UI Hospitals and Clinics, continuing the work of my remarkable predecessor, Dr. Ann Williamson, and others before her. Since the beginning, quality has driven all of our efforts. Patient care, exceptional, life-affirming patient care, is at the heart of everything we do. And this award, the highly esteemed Magnet Prize, is validation of that principle. At every level of our organization, we thank the American Nurses Credentialing Center and the Cerner Corporation for this extraordinary honor.
Congratulations to the Department of Nursing Services and Patient Care. The Magnet Prize is impressive recognition of the exceptional efforts of our world-class team. At the heart of Iowa's world-class medicine is world-class nursing. For decades, their groundbreaking work has advanced the nursing profession and impacted the lives of countless patients. All of us at University of Iowa Hospitals and Clinics are enormously proud of this achievement. Bravo!
You might not think of Iowa as a likely place for creativity, imagination, and ingenuity. But surprisingly, innovation and the adoption of innovation are hallmarks of our state. With a rich history of inquiry and pragmatic common sense, we know how to get things done. It was Iowa's own Everett Rogers whose groundbreaking theory of diffusion of innovations inspired our own innovations, helping our evidence-based practice program sustain decades of progressive, systematic success. In the 1980s, at UI Hospitals and Clinics, leaders saw a clear future for the role of nursing in improving patient care. The time, place, and people together created an outstanding synergy for new ideas and opportunities. Our trail to EVP begins with University of Iowa College of Nursing Dean Geraldine Felton and Director of Nursing Sally Mathis. Dr. Felton zeroed in on the conduct of research while Ms. Mathis focused on application. They brought together a team of emerging leaders, and our very first NIH-funded nursing research study led to identification of a need for an Office for Research and Application. A memorandum of understanding soon formalized the collaboration between the department and college, linking research to practice and changing patient care forever. Nurses were excited about the new research opportunities and the ability to directly and positively affect patient care. Dr. Kathleen Buckwalter, the first nurse scientist hired by the department, remembers the energy and excitement and how the timing was right for positive, empowering change.
This was evolving the educational component, the ability to do research, at the same time when nurses and nursing itself was being empowered. My primary role was to get people excited about nursing research. I actually thought I was going to have to beat the bushes, when in fact, There were so many people who were absolutely ready to transform their good clinical questions into research proposals. Another important aspect of my role was developing hybrid research teams, and that's the best of the best. You have the research skills, you have the clinical expertise, working together on a common problem. There were many tangible outcomes of this collaboration, but I would say the real highlight for me was seeing the enthusiasm of the nurses here for conducting research or using research in their practice, and also their willingness to work with others to bring about the best quality of care.
From the beginning, the ultimate goal for all nursing research has been improving patient care and outcomes. Each project led to development of clinical practice guidelines and what we now call evidence-based practice. And of course, the Iowa model. The development of the Iowa model built upon the work of other Iowa nurses and continued the collaboration between the Department of Nursing and the College of Nursing. The Iowa model of evidence-based practice to promote quality care has become one of the most frequently used process models to guide incorporation of evidence into nursing practice. The Iowa model blazed a new trail for nurses to use research findings to improve patient care. Like all the best trails, it provides clear direction, offers practical and systematic steps for teams working through the complex EBP process. For 20 years, users have reported the model is both effective and easy to follow. It's also constantly evolving to meet the needs of today's clinicians, with a third version currently in process. In recognition of excellence, the Iowa model's originators received the 1997 Sigma Theta Tau International Research Utilization Award. These Iowa nurses were risk takers with a passion for nursing practice. They focused on goals without getting lost in the details. Their skills gave them the tenacity to move forward and to have, with a commitment to collaboration, they welcomed new contributors to the table. Strength and confidence made for friendly competition that kept everyone innovating. Dr. Tony Trippreimer, the very first director of the Office of Nursing Research Development and Utilization, recalls the camaraderie and the shift in thinking as research opened for both faculty and clinicians, and the strength of nursing as a science was acknowledged.
The focus shifted to clinical nursing research, and that was why these projects were now morphing into existence. The fun part is being with a really dynamic group of people who are enjoying what they do, they're passionate about it. It gives me enormous pride. It really moved science base into nursing practice, and that for me has been the most rewarding aspect of what I've done here at Iowa.
Research in EBP flourished in the Department of Nursing as well as the college. Studies of pain management and family visitation led to translation to practice. This improved pain assessment and management well ahead of the Joint Commission standards and transformed visitation procedures long before the current emphasis on the patient experience. EBP work in practice highlighted the need for highlighting and networking and shared learning among clinicians and researchers from around the world. In response, the National EBP Conference, now in its 22nd year, has included speakers and attendees from 48 states and 11 countries. The conference has become a mainstay for organizations eager to learn more about EBP. Dr. Marita Titler, one of our visionary leaders, helped blaze our trail. We've learned to stay true to our guiding principles. Dr. Titler emphasizes that point.
This is really about patient care, improving patient care. So keeping that central is important.
And Marita, we got her done. We've learned important lessons at every twist and turn of the trail. We've learned that creating an EBP culture requires the right infrastructure and organizational systems approach, as well as a multi-phase plan. We've learned to include nurses at all levels with the interdisciplinary team and key stakeholders. We've learned to evaluate our work for continuous improvement, to demonstrate a return on investment, to watch for new opportunities, and to always mentor our clinicians. We continue to learn from patients, from staff, from each other, and from you. And what we all learn improves the lives of our patients.
I was impressed with the quality of care I received from the nurses. Each nurse took time to talk with me. I told them I was a nurse and I had questions. They were very knowledgeable, as I said. They answered my questions and would explain why certain procedures were being done. So I had asked for a nurse anesthetist, and she was going through her checklist with the staff in the operating room. As she went through her checklist, she used the word difficult. And after she finished her checklist, I said, "Why did you say that there was something difficult about my care?" And she paused and she said, "Oh, that was to tell the staff what equipment I will need. But I hadn't really thought about what it sounded like to patients. I'm so glad you asked me that. Now I've learned something from you, and I wanted to explain to you why I used the word." I thought it was a terrific opportunity for me to be more comfortable, and she really was very professional in her response to me.
Exceptional patient care comes from engaged and empowered staff in all healthcare settings. A key component to the success of EBP is involving staff at all levels, allowing them to fully participate and giving them responsibility for outcomes. This approach, effective in both bottom-up and top-down cultures, empowers all nurses to question practice, leading to greater ownership, fulfillment, and success. In 2001, UI Hospitals and Clinics developed the EBP Staff Nurse Internship to provide a structured 18-month immersion experience and ensure success with the application of extensive resources and mentoring. This internship program was designed to help staff nurses learn how to use the Iowa model while creating practice changes that address relevant clinical needs. And as Ms. Nancy Dole tells us, the experience can be life-changing.
This program is a non-fail program. You have people who are there to guide you all the way through it. They help you set up your team. They help you organize your thoughts, organize your ideas, and then how to realize how to put them together. We all provide excellent care. And this is not a program that finds how we don't provide excellent care, but it's how we take that care to a next level and how we can make that better for our patients and more satisfactory for the nurse.
As staff nurses lead EBP projects, they collaborate with multidisciplinary teams and receive education, support, and active mentorship from unit leadership teams. Since 2009, select program graduates have returned to mentor other interns through the EBP process. The program has successfully met organizational priorities with an impressive return on investment. Building one EBP project on another creates an EBP culture with exceptional impact on patient care. One unit exemplar is our medical intensive care unit, and in particular, the enteral feeding project.
Today we're going to learn about the aspiration risk reduction algorithm and feeding protocol that are instituted in the MICU. This is an important evidence-based practice project because our unit is at high risk for aspiration pneumonia. If you have any questions about this project, the unit resource book is available, or you can ask any of the nurses from MICU. They were all very supportive and knowledgeable about the project, and it took a tremendous team effort. And this all kind of dovetails in with some other protocols that we have on the unit, the sedation management protocol. So as we're supposed to be minimizing the sedation for our patient all the time, that too is going to fit in with helping them tolerate their feeds better. The insulin management protocol, same thing. If we keep the blood sugars under control, we're going to help this also.
The MICU's EBP projects have led to a sustained reduction of more than 80% in the rate of ventilator-associated pneumonia. In 2012, the MICU reported no VAPs in 19 of the prior 24 months. In recognition of the group's exceptional teamwork and process and their impact on patient outcomes, the U.S. Department of Health and Human Services Office of Healthcare Quality presented the MICU Interdisciplinary Team with an Outstanding Achievement and Leadership Award in 2012. Our trail is open for anyone to follow. UI Hospitals and Clinics has offered the Advanced EBP Institute since 2002. This program, held 40 times and still going strong, mentors nursing leaders to successfully guide staff toward integration of EBP in complex healthcare settings. The ripple effect has been enormous. The most recent evaluation demonstrated a statistically significant increase in self-efficacy as measured by the evidence-based practice self-efficacy scale. The Institute provides guidance to nurse leaders across the country and around the world. These participants take their knowledge home, sharing their learning and transforming their infrastructure. The continued mentoring of clinicians is vital to all facets of our EBP program. We provide that formal support through the nurse residency program. We are the 11th hospital of 13 to achieve this national accreditation. This program supports new graduates transitioning into their clinical roles as nurses. Utilizing the Iowa model, these new nurses tackle EBP and are empowered to create a measurable impact as they complete projects. This EBP experience early in their careers stimulates additional innovation long after their residencies are completed, improving patient care for generations to come. For example, the unit-based mentorship program designed by Ms. Ann Bai.
For my nurse residency evidence-based practice project, I created a unit-based mentorship program. I've really liked this project because I've been able to bring it back to my unit and see the benefits that the mentorship program has brought to our unit, such as increased retention, increased staff morale, and just overall unit cohesiveness.
The ultimate goal in all these programs, projects, and efforts is improved patient care. Nurses from other organizations have reported that they would not have achieved their own magnet designations had it not been for the help they received from nursing staff at UI hospitals and clinics. As we've blazed our trail, we have found several essential steps to improving staff engagement: topic selection by staff nurses, matching clinical, systems, and EBP expertise, starting the program with a small group of participants, tackling the challenging steps of implementation and evaluation, and creating plenty of networking opportunities. Empowering clinicians in leadership development for evidence-based practice affects every point of care. Each role is essential to form a fully functional and successful interdisciplinary team. When clinicians are empowered, they are engaged. Fully engaged clinicians are inspired by their work and provide the highest quality evolving patient care reflected in stories like this.
The ICU nurses should be commended for the skills they demonstrated, their unending support toward our family's need of explanation, and the compassion demonstrated towards both our son and our family. We never felt in the way. Every nurse allowed visits beyond visiting hours. As I went in for a visit, Sarah was softly singing to my son. Lindsay spent her entire shift finding the correct amount of pain medication needed. Everyone worked so hard to find a comfort level for our son, always smiling and reassuring us. Medicine is wonderful, but without this fine group of dedicated individuals, this level of comfort and compassion would not exist.
The need and desire to improve patient care and outcomes does not end, so UI hospitals and clinics will continue to blaze new trails in EBP. Even now, we are advancing EBP with the development of exciting new tools and initiatives that ensure a lasting impact on the nursing profession. Going back to Roger's theory of the diffusion of innovations, and guided by the Iowa model, we have developed and tested tools that have turned innovation into implementation and implementation into sustainability. These include the EBP self-efficacy scale, the implementation guide, the implementation guidebook, and the EBP to Go resources. These tools make it easier for organizations of all sizes and experience levels to incorporate and sustain EBP for the long-term benefit of their patients. Since January 2013, we received well over 1,000 requests for these tools from throughout the United States and all over the world. Another outcome of our EBP work has been our Sacred Cows initiative. This program sought out sacred cows, those old practice habits considered routine and above dispute, regardless of evidence, and we put them to the test. A group of nurses committed to investigating these old habits, who became known as the Sacred Cow Wrestlers, led a full-scale review of 14 practices identified in 2 articles published by the American Association of Critical Care Nurses. Practices like restricting cell phone use, limiting visiting hours, and the use of indwelling urinary catheters. The Russlers graded our practices and identified where change was needed. One of our own identified sacred cows, the use of milk and molasses enemas for treatment-resistant chronic constipation, has become a research project led by an intern from our nursing research internship program. Staff nurse Jackie Wanguveri tells us about the project currently underway and what the program has meant to her.
Well, milk and molasses enemas came about as an old wives' tale, or it's been used for decades and decades. We know it works. We don't have any research to back that up. The research internship has opened up this amazing door to where I'm just thirsty for knowledge. We want to give them things that we know have research and evidence backing that up. And that's what I would want if I was on the other side. If I was a patient, that's the kind of care that I wanted to provide. Just excellence in nursing.
As Jackie highlighted, excellence in nursing is a core value of our nursing research internship program, as it is in the EBP internship program. Both are guided by the Iowa model. Nursing research interns, however, learn more about research methods and processes and develop studies aligned with their burning clinical questions, like when a practice used for one purpose might show great promise for another.
Since being in the nurse residency program, which has instilled a real desire to try to find evidence behind our practice every day, I have been fortunate enough to be a research intern at the University of Iowa and have conducted a study looking at the effect of lateral rotation on skin integrity in our ventilated patients.
As we blaze our trail into the future and focus on long-term impact, we continue to add new dimensions to our work, including developing a program of research on implementation science and healthy behavior. Changing unhealthy behaviors and fostering health and wellness for both our staff and patients is a continuing passion of our team. So we are targeting those environmental factors that facilitate behavior change and are based in best available evidence. We have funded research grants on reducing nursing stress through mindfulness. We have a study in progress to understand the cognitive work of nurses, and we have supported promoting physical activity within daily workflow, which medical assistant Carrie Korshkin appreciates.
Personally, it helped me lose weight, helped me get into better shape. I felt better not only here at work, but I felt better at home because I felt like I could get in my physical activity without having to stress about when am I going to find time to do that. I can do it on my lunch. I can go in a little bit early and get it done. So overall, I just felt great. I have more energy. So the problem, I think people, they get into this habit of going and eating a big meal at lunchtime. That sluggishness, it brings you down. You just don't feel like that go-getter. So I feel like the patients benefit from us all having that energy. We go out, we get them, we're energized, we're happier, we're, able to be a good resource for them.
This focus on health and promotion of physical activity extends into our WellMe in 3 program. WellMe in 3 introduces brief bursts of physical activity and wellness into the workday, leading to improved fitness and alleviating fatigue. This translates directly into improved patient care as healthy and alert caregivers make fewer mistakes and are more engaged. Okay, you've all been sitting still for quite a while. Let's all sit up in our chairs and see the impact just 1 minute can have on your energy. And for all my University of Iowa colleagues, come and join us.
So what I want you to do is sit on the edge of your chair, and we're going to start to just pop your heels up. Start moving your shoulders, whatever you want to do. That's all you have to do. Big thing about exercise is just moving. You can even just kind of wiggle around in your chair if you want to. They say people that fidget lose a lot of weight. Now we're going to walk it out. So all we're doing is pumping these legs. Good, there you go. Same thing, but you're going to walk a little bit wider. And start to lean. That's it. Bring your arms up here, bring them back together. How about that upper and lower body going now? Reach those arms a little higher now, up. Good, walk it out. Last little bit here. Good job.
Don't you all feel better? We find much reward in promoting evidence-based interventions for staff and patients that can be fun and make a positive difference, and even right here, right now in your chair. The scope of our EBP work can be small and personal. It can also be enormous and powerful. EBP principles and practices can have truly global impact. Our internships and institutes attract hundreds of participants every year. Thousands of nurses use our tools and resources, not just in hospitals, but in ambulatory settings, home health, and long-term care facilities. The Iowa model is widely used and freely shared, and we are humbled to know that countless patients from all over the world have benefited from engaged, committed nurses who strive constantly and consistently to improve patient care and outcomes. And we at UI Hospitals and Clinics are privileged to continue that work, blazing our EBP trail into a bright future.
Thank you, Sharon, and all of our colleagues from the University of Iowa Hospitals and Clinics. And thank you for traveling with us on our trail to EBP success. We are so happy to be part of a Department of Nursing Services and Patient Care at the University of Iowa Hospitals and Clinics. So proud to be members of a team that truly makes a difference, and so grateful to be involved in the lives of our patients. Would like to thank the American Nurses Credentialing Center for recognizing our efforts, and Cerner Corporation for sponsoring the Magnet Prize. It is an amazing honor that will continue to inspire us. Thank you.